Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, and welcome to another fabulous podcast of Research Perch, the podcast of the Massage Therapy Foundation with your hosts, Ruth, Werner, and Dr. Jerrilyn, Cambron. I'm literally phoning this in from the sunny Oregon coast, and Jerrilyn is with us from, I'm guessing, steamy Chicagoland. Is that about right?
You betcha.
You betcha. And we have a really, really interesting article to discuss today. This was one of our recent case report winners, a practitioner case report winner. And the title of the article is Bowenwork for Migraine Relief, a case report. And the author is Sandra L. Gustafson, who is a Bowenwork practitioner and a registered nurse, and a couple of other things from Santa Rosa, California. And so what we're going to do with this podcast, as we always do, is talk about this article. We're going to synopsize it, talk about its strengths and weaknesses of where it fits in the research hierarchy and of this particular article as well. And hopefully we will end with some discussion questions that might help you work with and process this a little further. So we encourage you to download the article, which you can get. How much does it cost to download articles from the International Journal of Therapeutic Massage and Bodywork? Jerrilyn?
This is a no-cost journal. So if you want to download and read articles, it doesn't cost you anything. And if you're an author and you want to submit articles, it doesn't cost you anything either.
Right. This is not a pay-to-play kind of organization. So we encourage you to go to the International Journal of Therapeutic Massage and Bodywork, ijtmb.org. In the search box, put Bowenwork. It'll be easy. It'll come right up. And while you're there, you know what? Register for the journal, or what do we call it? Subscribe to the journal. And that way it'll be delivered to your inbox every quarter. So let's go ahead and dive in and talk about this Bowenwork for migraine relief. And here's a quick synopsis of this. This is a case report, which is a story of what happens between one therapist and one client. And what happened is here's a client who is a middle-aged woman who was really having a lot of impairment in her life and in her quality of life from chronic migraine, who had an associate who was in school for Bowenwork, which is a particular kind of manual therapy, and had one treatment with a student and decided, oh, there's something interesting here. I want to pursue this. So she ended up having a longer series of treatments, actually quite a long series of treatments with this Bowenwork practitioner, and having substantial improvement, not only with her migraine symptoms, but with a number of other symptoms as well. And so this therapist wrote up this interaction in a format that all scientists have to use, and related to us, to our audience, what happened here. And there are some wonderful, wonderful strengths about how she did it. I think one of the things I really love about this case report is it forms a really nice model that other practitioners of any kind of bodywork can follow, so that readers can see what was useful, what was less useful, and can maybe recreate this in their own contexts. So Jerrilyn, why don't you talk to us a little bit more about where case reports fit and why they're important, and strengths and weaknesses of case reports in general.
Oh, sure. Case reports are the lowest level of evidence, just above opinion. But the good thing about case reports is it's very real to clinical practice. They are created by practitioners who are in the field actually treating patients. So case reports aren't done by researchers. So even though they're low level of evidence, they're very important because they kind of form the bottom of our triangle of research hierarchy. And so when case reports come out, they come out in scientific journals for all to read. They're on PubMed, But what happens is researchers then will read case reports and say, well, isn't that interesting? Perhaps this is something that we need to study further.
The other nice thing is that practitioners can read case reports and go, oh, I could do that.
Yeah, absolutely.
For my client who has migraine, or my client who has whatever. So
they're actually easier for clinicians to read because they don't include all of the statistical analyses that clinical trials do. And they're very real to life, and they're only about one person. So they're just very easy and accessible and interesting.
Mm-hmm.
But they might be very biased because it's only one person, and what happens with one person may not ever happen with anybody else.
Right. So it's important in case reports that the author not use words like "this proves" or, now I've determined that massage is effective for whatever. It's a what happened with one person.
Right.
Good. And then the last thing I love about case reports is that referring doctors can look at case reports and get a snapshot about what our work really looks like. And you can't do that with a clinical trial either, really. So let's talk a little bit about this report in particular. This is about a client who has migraine headaches, and she has a really nice, fairly detailed, fairly technical description of the process of migraine headaches here, which are quite complicated. And, I could spend our whole 20 minutes of research perch talking about migraines, and will if you don't stop me. But what I can share is that the explanation given for migraine here about hyperexcitability and neurogenic inflammation and trigeminal nerve irritation and cortical spreading depression. This is technical information. It's pretty well explained here, although it might leave some readers with more questions than with answers. But I will say, as someone who stays on top of this information, this is current. This is sorry, my husband's leaving on a camping trip. Bye, honey. This is current. This is accurate. It is definitely in alignment with how the medical field currently is looking at and talking about migraines. And so, it's completely usable in that setting. And then she talks about what Bowenwork is. And this is something that maybe a lot of our listeners might not be familiar with. Bowenwork is a type of manual therapy that comes out of Australia. And it is a stretch to call it massage. Lots of Bowenwork practitioners consider that they are not massage therapists. And in fact, the author of this article is not a massage therapist, but she's a certified Bowenwork practitioner through their training. And the idea behind Bowenwork is that it really acts. The intention is to access proprioceptive reflex responses. So it really is a neurological kind of treatment that looks at manipulating the skin and underlying tissues in such a way that it creates some reflex responses. And it's been pretty thoroughly mapped out. So there's a specific protocol for different parts of the body. And so what this person did was evaluate her client with migraine, make some theories about both, relying on the theories about how Bowenwork works, and then looking at what she saw as potential contributing factors to this client's migraines. And that is how she compiled her treatment rationale and her protocols that she pieced together out of the Bowenwork segments. So that's a quick look at the introduction and the overview of the research question. The research question really is, might Bowenwork be effective in reducing the frequency and I know it was frequency, but I think it was also intensity of this person's migraines. And she ended up using a wonderful tool for tracking this, and I'm going to let Jerrilyn talk about that as we move into talking about methods.
Sure. And like you, I was interested because I really know nothing about Bowenwork. I've never had the technique. I've never seen it performed. And so I was very glad that there was a description of what it actually was. But in this study, she also, or I should say case report, she also describes the assessment measures, which is called MYMOP2. And it's MYMOP2. This is a fairly new outcome measure, and it's kind of a cool thing. It's very personalized for each individual client or patient. It's called Measure Yourself Medical Outcome Profile, which is why it's called MYMOP. What this survey is each client, when they are presented with it initially, they have to come up with their 2 main symptoms that are bothering them the most. And then after that, every single time they come in to get treated, they fill it out based on what symptoms they originally indicated as being problematic. And so with this client, she said migraine and neck pain were her 2 main symptoms. So it's an interesting outcome measure in that it's very specific, and it's great for case reports, and it's great for clinical practice. The hard part in clinical trials, in larger scale studies, is everybody has a different symptom. And now we can't really make overviews in saying that pain decreases, by this percent, or we can't say that disability or function changes, because everybody has a different symptom. And so it's a great outcome measure. I encourage you to take a look at it. You can see them online, but I don't know that they're good for, or as good for, large scale studies.
No, but they are literally tailor-made for case reports because they are so personalized.
Exactly. Yep. Yeah. So this client, she initially came in. They scheduled. Boy, I should say that she started out with debilitating migraine since childhood, and then she had a car accident at age 48 and another car accident at age 56. And so she presented when she was 66 years old. So she's had a lifetime of migraines, headaches, neck pain, and really was just looking for anything that could help her. She was provided with narcotics and muscle relaxants. She did not like that. So what she ended up doing was, when she had these headaches, which was very, very frequently, she would take 8 to 12 200 milligram ibuprofen a day, which that's going to tear up her stomach and her GI tract.
Yeah, it's courting stomach and liver damage. So yeah.
Oh, absolutely.
And she was having her migraines 3 to 4 times a week. And if you've had a migraine, you know that's 12 hours or more per headache.
Mm-hmm. So over several months, I think it was 4 months, there were 14 different sessions. And what they were looking for was to decrease the symptoms down to 0, down to nothing over the course of 2 different treatments. And so if they can have 2 consecutive treatments where the symptoms are at the level of 0, then with this therapy, the client is done, which they were almost able to do around session 8 or 9 and 10, but that's when the car accidents happened. And so then they continued on with care, and by session 14, they were done. But, this was a really interesting study. And I thought that the tables and presentation of it was just very, very clear. I, again, didn't know anything about Bowenwork and was surprised at these results, considering the patient had these symptoms since childhood, and to have just 14 treatments and feel like, okay, the symptoms have completely resolved was practically miraculous. And so, of course, I'm very interested in this technique now, and wondering, gee, what does it feel like? What is it all about?
Well, and one of my questions, when you see a big result like that, one of my questions always is, how long is that going to last? And there was, to play devil's advocate here, there wasn't an official follow-up that was reported within the body of this of the time that these people spent together. But there is a mention here that the client reported being migraine and neck pain free when she was followed up 10 months later with no new symptoms. And I believe this is she also had undergone surgery for carpal tunnel syndrome during that time, and just in general was having a much better quality of life. So I'm really, really pleased that this practitioner reported that.
And the ibuprofen use went down to 0. Right. So went from taking 10 to 12 ibuprofen a day to 0. I am
Yeah.
just amazed at this. So I agree with you. I'm always suspicious when miraculous results like this happen. I'm really glad that she reported that there was contact after 10 months to find out what was going on. And, this just seems like a technique that really worked well for this one client. It's necessary to do larger scale studies to see if this is as effective for other people with this type of headache condition, but looks really positive just based on this one case report.
Yeah, I think we can be really pleased certainly for this client, and I'm very pleased that this practitioner reported it. I want to emphasize this was a prospective report. In other words, they decided ahead of time that they would work together in order to, track these results in a way that might eventually be reported to the public. And that makes writing case reports it allows you to do some things that sometimes don't happen when we don't make that plan ahead of time. So if listeners are thinking, scanning your head for clients that you have who have various conditions that you'd like to try this with, it can be definitely, it can work to do a retrospective case report, but doing prospective ones allow you to set some baselines and to sort of explore and create rationales for your treatment choices in a more methodical way than sometimes we do when it's, Mr. Jones and his headaches today.
Well, as a researcher, of course, I have to advocate for you should be treating every patient or client like this, where you track outcomes over time and you look at changes, regardless if it's going to be a case report or not. Treat every client that comes in as though they're going to be your next case report, because you may have somebody that comes in and you're treating for one thing and suddenly something else gets better and it was just a complete surprise. And so by tracking, you're able then to write it up much more easily.
Right, absolutely. So we thought about some some possible discussion questions, because we'd like to encourage our listeners to use Research Perch as a launching place to maybe think about bringing to a group discussion or a classroom discussion. And so some of the questions we came up with about this study that you might take home and chew on for a while are these. One of them is Bowenwork. One of the restrictions around Bowenwork is that they ask that a client not receive any other kind of manual therapy while they are in the treatment series, because the concern is, we're sort of tuning the nervous system. Let's not mess it up with some other kinds of signals. And so, that is a restriction that may or may not sit well with people. And I'm wondering, is knowing this, do you think that strengthens or weakens the Bowenwork in general and the findings of this case report in particular?
I like that question so much, because really it can be argued on either side of it. So
yeah. Oh, absolutely. Absolutely. And I only know a little bit about Bowenwork because I happen to have met some people who are involved with it, and I've had one session. So I don't have, I don't have enough to have an informed opinion about this, but I think it's interesting to talk about. So another question is, Bowenwork practitioners do not consider that Bowenwork is massage therapy. And as we mentioned, this practitioner, I do want to read her practitioner description, because she's no slacker. Here we go. The practitioner works in an integrative healthcare office as a self-employed licensed registered nurse, holistic health consultant, and professional Bowenwork practitioner. She has a Bachelor of Science in Nursing, a Master of Health Science degree, and 25 years experience in conventional and integrative healthcare, and 24 years experience in practicing Bowenwork. So she's, but you'll notice there was nothing in there about being a massage therapist. And I'm wondering, in many places where there are licensing considerations for professional touching, massage therapy turns out to be the best match for Bowenwork practitioners. And so they get licensed in massage and then they do what they want to do. But I'm wondering if, knowing that Bowenwork practitioners do not consider themselves to be massage therapists, if that influences the way you hear or can think about this project. And then there are several hypotheses in this article that form the basis for the practitioner's plan. There are hypotheses about how Bowenwork works. There are hypotheses about the multifactorial aspects of migraine. I'm wondering if you can dig out some of these hypotheses and feel like if that makes a strong enough scaffolding for your thoughts about this. And then lastly, I'd ask, if there's anything in here about that might inform the way you look at your next patient who has migraine. Most of our listeners are probably not Bowenwork practitioners, but now and we try to do podcasts about things that might help people in their practice. So I'd be really interested to hear what you see in this case report that might influence the way you go forward with your clients who have headache.
Absolutely. And, if there's a technique that you use that isn't frequently in the literature, please consider writing a case report. It's really the best way to get started along a line of research, and researchers may not know about your technique. I did not know about Bowenwork and what this is. And so by reading this one article, now I feel like I'm a little bit more informed about it. It's becoming more evidence-based practice just by kind of stepping into this realm. So I strongly encourage you to consider writing a case report and submitting it for publication.
Well, and one of the things Jerrilyn said to me as we were preparing for this is, she said, "Oh, I've never heard of Bowenwork before, but I want to find out now. I want to receive some now." So, yeah. So great. So I think that kind of wraps us up for this report about Bowenwork for migraine relief, a case report. If you have comments or questions, or things that you'd like to sort of put into public discussion, let us know. And we'd love to encourage you to talk about this podcast and this case report with your community.
Thanks, everybody. Bye.
Thanks, everybody. Bye-bye.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.